Right, so welcome, and it is my distinct pleasure and privilege to welcome everyone to this roundtable discussion using data to promote equitable outcomes, which is hosted by the Social Policy Institute at WashU in partnership with the MasterCard Center for Inclusive Growth, St. Louis Regional Data Alliance, and data.org. It's really an incredible offering and opportunity to welcome a few special guests and presenters to help facilitate the conversation today. So we'll introduce them in just a bit, as well as encourage everyone to continue posting into the chat so we can see who's in the room, your name, organization, and affiliation, and following the pre-show antics. If right now you could take a trip anywhere in the world, where would you go? Feel free, if you're just joining us now, to post in the chat and say hello to everyone who's in the room. So the Data Science for Social Impact Initiative, the objective here, in partnership with some incredible national and local organizations, is to develop a set of training and resources for St. Louis social sector organizations seeking to utilize data more effectively to increase impact and promote equitable outcomes. Very early on in this initiative and this work, through our conversations with colleagues and leaders in St. Louis and beyond, we've identified a gap that most training and learning opportunities that's currently available around data science and social impact tends to be technically focused, geared towards aspiring data scientists, and not necessarily reflective of the unique needs and opportunities for the social sector, and particularly in St. Louis. So as part of this initiative, we are in the midst of an incredible series of engagement opportunities. So in addition to doing robust scans of what already exists and identifying some gaps and how our work might help to fill them, we've been engaging in these roundtables and individual stakeholder interviews, all leading in us to here today, and then looking for these conversations around critical topics around data science and social impact to springboard into some pretty incredible training and learning opportunities for folks early in 2022. So you can see how this has progressed. And most importantly, we're not doing this alone. We're obviously here all this morning together on Zoom, thinking about these critical topics and considerations with some of our most favorite colleagues and friends from around St. Louis and the country. But we also want to acknowledge and thank an incredible advisory committee that's formed to help us from conceptualization of this project, of setting some really fantastic visions and values of the work that we're doing, and who will be instrumental to the actual construction and advising around what this curriculum looks like. And perhaps, as you'll see today, helping to facilitate some of the conversations, thanks to Amin, Rayid, and Allie. So all of that said, it's my pleasure to turn things over to Jen Rose Fitzgerald, who's the coordinator at the Social Policy Institute, to talk us through a little bit more about what folks can expect today. Jen Rose?
Thanks, Dan. So as Dan said, these roundtables, a big part of their role is to get some feedback of what kinds of tools and resources would be useful for social sector folks who are trying to think more about data for social impact. And so the goals here are to facilitate dialogue, today's conversation about the complexities of using data to promote equity. It sounds like a great, simple idea, but of course, equity is never simple, and data is never simple. As far as the format of the roundtable today, we have some great speakers who are going to present and discuss a real-world scenario about using data to promote equitable outcomes. And then the participants will join in the discussion in the breakout groups and dive a little bit deeper. So we look forward to hearing what they have to say, and we look forward to hearing your feedback as well. And so without any further ado, I would like to introduce our first speaker. Amin Mashariki is a principal scientist and the head of AI cities at NVIDIA, where he works to build complex AI solutions that solve intractable urban challenges. That's a mouthful. In a previous life, Dr. Mashariki was Chief Analytics Officer for the City of New York and the Director of the Mayor's Office of Data Analytics. He ran the Civic Intelligence Center that allowed one of the largest cities in the world to aggregate and analyze data from across agencies. And these are just a couple of the hats he has worn over the course of his career. So please join me in welcoming Amin Mashariki as he kicks off the conversation today.
Thank you so much, Jen Rose. And it's a pleasure to be here, and it's a pleasure to work with my fellow facilitators, Rayid, Ghani, and Allie, Chang, Ray, to really talk to you and engage with you, I think mostly around using data for equitable outcomes. And I want to set the stage. We're going to present a scenario to the group and really start a conversation around this scenario. And before I start, I really want to get across that, one, this is a real world scenario that from my time as Chief Analytics Officer in New York City, I came across. There's no, even up to this point, there's no real solution. There's still conversations going on today about the right way to engage around this scenario. And so we don't expect clear solutions, but what we're hoping for is to really learn from you guys on how you're thinking about, how you would think about engaging on this particularly challenging scenario. And so I'll read the scenario out loud. And maybe add a little bit of color to it as I'm reading it. So our organization is tasked with identifying the optimal and most appropriate, from an equity lens, locations for shelters across the city. So in this case, your city has essentially said, hey, there's a multi-pronged way to tackle homelessness. So one, from this scenario, we're not presuming this is the only way to tackle homelessness. There's a multi-pronged way. One of those prongs is because this city is a right to shelter city, meaning if someone wants to get off the street and get into the shelter, it's their right to do that, and the city has to provide that capability. So one of the things to get people immediately off the streets is to ensure that you have shelter capacity. That's step one. There's probably 100 more steps to really solving homelessness in a city, but that's step one. It's getting people off the streets, especially when it's cold or hot and so on and so forth. And so when your shelters are at capacity, you have to now invest in creating more space and more shelters. And one of the things that has happened is that they have asked us to develop an approach using data, geospatial data, census data, any administrative data, meaning any data that the city has access to, along with engagement and getting feedback from elected officials, community leaders, and residents to identify locations for where we should build new shelters. Now, one of the key things around this is that there are communities in our city that have said, hey, historically, you are consistently putting shelters in certain communities, meaning there's no equity in how shelters are being placed across the city. So what we found is that in a lot of low-income communities is where a lot of the shelters are being placed. Also, we found that where there's more rental units, shelters are being placed. They're not being put in the more residential areas and so on and so forth. And so a lot of the communities have stepped up and said, hey, you're not just going to keep putting shelters in our community. Now, once we were engaged, we meaning this group of people were engaged to use data to identify the best places, the optimal places to put shelters. We made some suggestions, some initial suggestions of 10 to 15 shelter locations to put those shelters in. And the idea was, hey, let's spread these out, because the initial feedback was, hey, we're just clustering these shelters in certain low-income communities. The idea was to spread these out. We began to put these shelters into other communities that didn't have a lot of shelters located in there. And it could be high income, low income, middle income. We just started to put them out. Then a news article came out that basically said, hey, in this city, we're putting shelters into locales and regions and areas of the city, which is forcing the shelter clients to have to go outside of that neighborhood in order to get the services, meaning they may have clinical services that are not in that neighborhood. So they now have to travel a long way to go to their clinical services. Their children or they themselves have school outside of that neighborhood, so they have to travel a long way. Also in those neighborhoods, the price of access to resources such as food and so on and so forth are high, exorbitantly high compared to other communities. And so people from the shelter are now complaining about the cost of food and to eat, right? And so you made a decision to be equitable in terms of placing these shelters, but now you're getting all sorts of feedback that is not positive in terms of the placement of these shelters and access to resources. And so now people, the clients in these shelters, are now concerned about the locations themselves, right? And so here's some key, guiding questions, right? What are the goals for selecting locations? Who defines these goals? How do you weigh competing priorities and voices? What data or mode of analysis is most useful to finding equitable outcomes? And how will you test, validate to see if your solution is effective? And how will you communicate with the public, right, about this approach? And not only the public, but elected officials and people who are tracking the impact of these sorts of placements. And so just reading that scenario, I imagine there's a lot of ways that you could go about thinking through solving this problem, right? So the idea is that we move the ball, but now we're getting a lot of feedback. And so how do you go back in and ensure that you're thinking about data and applying that data in the right way for equitable outcomes, right? And so just to set the stage for this, again, there is no clear solution. Really, what we want to offer and the type of engagement we want in this roundtable is feedback from you on how you would think about this, on some of the priority, where would you put the priorities in responding to this challenge, right? Is the priority on the data side? Is the priority on the community engagement side? Is the priority on the feedback from community leaders, right? Or elected officials, so on and so forth. And so there are all of these competing voices and priorities. And I think the idea here for presenting this scenario is really thinking about what are the things that you think about? And the idea is, how do we take all of those things and really build a strong strategy for using data for equitable outcomes? And so I'm going to take a couple of minutes to tell you how I, did think about this particular challenge, but then also, where we went, where I think we weren't optimal in our sort of response to this. I mean, first and foremost, one of the best things that we did was we engaged at the shelter level, right? And so we went to, in New York City, shelters are outsourced to private entities. And so each shelter thinks about their remit very differently from each other, right? And so one of the things we did, so you can't just go to the head of Department for Homeless Services and say, how do shelters think about, how do we think about placement of shelters? How do we think about any of these things? It all it gets outsourced to private organizations, nonprofit organizations, and so on and so forth, right? And so one of the things we did was we reached out to all of those organizations and we engaged them individually on some of their challenges and the things that they see are valuable and useful, specific to the location of shelters, right? Access to services, access to transportation, so on and so forth. I think where we missed the ball was we talked to each entity separately, but we didn't talk to them as a unit, as a group. My office didn't have the capacity to convene that. So there's a question there, right? Like the data people don't have a capacity to convene these large efforts. I think second, where we missed the ball was these shelters and these organizations that manage these shelters have a lot of data about themselves, about the day-to-day execution of services and capabilities for their clients. The biggest challenge is a lot of that data is not open and available to be shared, not because of any laws or any policy, it's because it has historically never been open and shared. And so it makes for a challenge when you go into a room and you say, hey, what data do you have that you can share? And they say, well, we don't have any data. And that's not true. They have a lot of data. They're just not built to share data and to use data operationally, right? And so we missed the ball on that. Only thing we had access to was data that the city had access to. And that's always, the city tends to generally know less about itself in data than it should. And so the government, Department of Homeless Services and so on and so forth, these government agencies have a lot of data, but it doesn't get to the crux of really solving a lot of these more complex challenges. You have to be able to build relationships with the nonprofits, the academic institutions in the community. And so we missed that opportunity in a big way. But I think the convening and the engagement side was really strong in terms of what we did and meeting with folks at the community level. We just didn't really convene a roundtable effort. But so I just wanted to put that into context of how I thought about this, and where I think we missed the ball was getting access to really useful and helpful data to make key decisions. And then lastly, I'll just end this off by saying, using data for equitable outcomes is interesting. And this is why the scenario was set up this way, is because there's this concept called analysis paralysis, right? Like, you can think about and you can sit around in a circle and talk about all day long what you believe the equitable outcome of this effort is going to be. But what's key is moving the needle, executing, seeing the on-the-ground results, taking that information back, and then going back to this sort of, to the drawing board and doing this. In the tech world, it's called DevOps, which is like this sort of round table of analysis, execute, test, feedback, go back to analysis, execute, test, and you keep doing this. That's this development operation cycle. They move that to the data called MLOps, and then you do the same thing, right? And so how do you build an operational structure to execute, get some results on the ground, do on the ground validation, get that back, and then roundtable? I can tell you from my time in New York City, when my office responded to emergencies, we had that roundtable would happen within hours, right? You're talking 8 to 12 hours where you had first responders on the ground doing something, getting data back. We rethink the model, get more stuff out to the first responders first thing that morning, and then they execute on that stuff. And so you can move this pretty quickly. And so the question is that a capacity that can be built out across many cities and many engagements like this? Right? So I'll just pause there and hand that back to Jen Rose.
Thank you so much, Amin. That was really very interesting to think about your experience with this particular scenario. And one of the things that I appreciate is, with a complex scenario like this, there are a lot of different perspectives, and that's part of the point. So I look forward to hearing what others have to say as well. The next speaker that we have to just give a few comments on this is Rayid Ghani, who is a distinguished career professor at Carnegie Mellon University. He started and still runs the Data Science for Social Good Summer Fellowship, originally at University of Chicago and now at CMU. His work includes collaborative projects with government agencies and NGOs and research in areas including explainability, bias, fairness, equity, and so forth. And so I look forward to hearing what Rayid has to say about his approach to this scenario.
Thanks, Jen Rose. Thanks, Simon, for setting this up. And we're going to have breakout time to actually go into the scenario. I thought I'd give an example of a project that we did a couple of years ago. So this was work with Los Angeles around criminal justice. And so they have a team in the city attorney's office in LA that's kind of in charge of sort of reducing misdemeanor recidivism. And often, as you're all unfortunately, deeply familiar with the broken criminal justice system in our country, a lot of the root causes are, need for health services, social services for recidivism. So their goal was sort of how do we connect people with those services with the limited resources that we have, and again, that's an unfortunate setup here. Just like in the example in the scenario that Amin described, limited resources to only set up so many shelters, right? It's not like we can have infinite self-shelters. And so their challenge was they don't have enough time to kind of figure out who needs what type of services to proactively kind of get ready for it. So if they get arrested and get to court, the attorney's office kind of has a plan for them, has all the arrangements made so that they can connect them with those services instead of putting them in jail or worse. Right? So the question they came to us with was, if we had resources to kind of prepare these things for 150 people a month, how do we allocate those resources to get to equitable outcomes for people? So kind of similar scenario, right? Where we have limited resources, we're going to figure out how do we allocate these resources to get to equitable outcomes. And hopefully it'll become more clear why I'm talking about this. So we did was the first system we built for them was let's figure out the big problem was that the idea was, who do we create these resources? Ideally, you want to create these resources for people who are going to actually return, get arrested and kind of return to this issue. So the first system we built was sort of, we wanted to build the most accurate system. And I say accuracy in quotes because we'll talk about more of that. And basically that system was, let's say 80%, accurate, which means off the 150 people identified, 80% of them were going to come back. And so their resources would be 80% of their resources that they spent preparing these case files and preparing these arrangements would go towards people who needed that help. 20% would be wasted. But the system was more accurate for white people than Hispanic people in LA. And it turns out that the rate of recidivism for Hispanic people was much higher than white people as the starting point. So a system that's useful for both, but more useful for one group versus the other, if you sort of play that out, it helps both groups. So it reduces recidivism rate because you help them proactively, you reduce their risk of coming back, but it helps the white group much faster than the Hispanic group. So over time, you have sort of the rates of recidivism go down, but they go down at different rates. And so what it does, it ends up creating even more disparities. Starting from a place with disparities, you get to a point where it's even more disparities, lower rates, but higher disparities. So then we designed a system number two. We said, well, let's tune this to make it equally accurate for both groups. And that was going to be about 2% less accurate or 2% less efficient. So it's a 78% overall efficiency, but equal for both. So what does that do? Play it out over the next few years. It will reduce rates for both groups at equal rates. So it doesn't increase disparities, but it also doesn't decrease disparities. It just preserves the status quo and costs 2% more. So then we came up with option number three, which was, let's build a system so it's more accurate for people who need more support. And that was about the same efficiency as number two, so 78%. And that was more accurate for Hispanic people than for white people. So it again reduced rates for both, but it reduced them proportionally so that X number of years down the road, they had equal recidivism rate. And so that's kind of the menu we presented to them, right? As you have option number one, focused on efficiency. Here's the cost, how efficient it is. Here's the outcome, increased disparity. Option number two, status quo disparity, 2% more expensive. Option number three, 2% more expensive, equal recidivism rate. What do you want to do? And they chose option number three, as we kind of were hoping for. But that's sort of, the reason I was giving you an example, that's kind of an example of, we started off with a very high level goal. We want to build a system that does this, right? That helps people and that helps them allocate their resources. And often we go to the automatic kind of efficiency framing without quite understanding what it means. And then we go to the equity framing without quite understanding what does that mean? Like, is it equity so that's equal? And we've had all, and we don't often sort of, to Amin's point, right? Often the data and the technical people will sort of talk about the technical buzzwords and evaluation metrics and all these things. And the policy people will talk about equity buzzwords at a very high and abstract level without concretely defining what it means for people on the ground. And the idea is to sort of bridge those two by having the kinds of conversations we're having today, right? Is what do we actually mean in this case by equity? What does it mean to be operationally on the ground equity? What does it mean to have equitable outcomes? And I think one thing that sort of hopefully sort of becomes clear as we go through the breakout sessions is a lot of the questions we're going to be talking about, they're not going to be new. Just because, AI and data and machine learning and all these words and technologies exist, the questions are going to be pretty much the same questions. They're going to be about the value questions, about our societal goals questions. I think, and so the challenge is that the scale of the answers is very different. That the impact could be pretty different because as people develop a lot of these systems, it's not like they're going to build 100 different systems. They're going to start converging. So what used to be before is, some of the vagueness and the gray areas would allow for, some things to be better than others. The risk here is that if we build a thing to help these decisions, they might all do the wrong thing, and then we're kind of in trouble. So I think that's kind of the other pieces. I think in my mind, the scenario, we sort of talk about optimal, right? And optimal sort of assumes that there is a perfect answer there. And something we'll talk about again in the breakout sessions is what does it mean to optimize this? Or do we even understand this situation enough to even start optimizing it? Or is the first step really understanding the situation better, understanding the needs, understanding the goals? Yeah, so I think overall, I would kind of, as we go through the breakout session, I'm going to overall break it down very much like Amin did, is let's talk about what are the values that we need to design this system for at a more concrete level, instead of high level, equity and outcomes, which is, I don't know what that means. What outcomes for whom? And then how do we work with people to help design some sort of a system that helps us achieve those values? What components should add? Who should be designing it? Who should be involved in it? And then three, to Amin's point again, is, and then how do we actually validate that the system that we just built achieves the values which we wanted it to achieve? And how do we continue to monitor it so that it continues to do that? Because it's not a one-off thing that you have a conversation, you build something and it's done. So those are the three buckets kind of I would think about is, the values of the system that needs to be designed. What's the process for eliciting those values and deciding on them? How do we design a system to help achieve those values? And how do we actually validate and monitor and continue to ensure that it does what it was designed to do? Back to you, Jen Rose.
Thank you so much, Rayid. Yeah, it's really interesting to hear this from different perspectives. And again, I think everybody, depending on what their way in is, will bring a different perspective to this. It was really interesting to hear about designing these different options and what's involved in that. Look forward to talking more about that. So our last speaker is Allie Chang Ray. Allie is a nonprofit consultant in the areas of sustainability, collaboration, advocacy, leadership, governance, and management. Some of her more notable projects in which she has been engaged here in St. Louis: the United Way of Greater St. Louis Community Needs Assessment, the Missouri Child Development Account Collaborative, and the St. Louis Community Information Exchange. So I look forward to hearing what Allie has to add to the conversation.
Great. Thank you for that introduction, Jen Rose. Can you hear me? All right, wonderful. All right, so I am, for those of you who I have had a chance to work with her on today's call, you know that I come from a capacity building orientation, and in part because of my longtime work as an executive director. So I know many who are on the call have been in that role. I'm actually relatively new to the research realm. So I have more years in my past as an executive director than I do as a researcher. So I'm, unlike my two colleagues who are co-presenting today, I'm going to come at this a little bit differently from an operational standpoint, just to give you a different perspective. I'm also going to come from it from being a past funder. So some of you know that I have worked in that realm as well. And so my angles that I come to this at is when I looked at this scenario, I actually had a different set of questions. Part of it was looking at the utilization rates in terms of all the different locations. But then as I started to back into it a little bit more, I had other questions, which had to do with, that's really interesting that there is a different provider that is responsible for each of the shelters, right? But like, is there a common core of standards? Was each organization able to just develop it on their own? Did each organization receive the same sort of resources to be able to get started, right? Were the quote unquote rules of engagement the same? And so knowing from an operational standpoint, but then also from a funder standpoint, we know that the outcomes that we're looking for in each of these different communities, neighborhoods, while the population of homeless is the same, right? The situation is different. And so just like we would want to meet nonprofit organizations with where they are, we would also want to meet the communities where they are, as well as the stakeholders who are involved with those communities where they are. So when I was thinking about how I would answer this question, I would actually want to take a look at understanding what was different as well as what was the same, right? And from that, I would actually look at the data to see what kind of trends there were, again, from what was different, the same, and then how that impacted the utilization rate. One of the things that I know that for organizations, whether you are looking at program replication, expansion, et cetera, is that it is sometimes easiest to start with what you know and what you've been able to prove successful, right? But what we know is that the conditions for each of those communities, each of those situations is completely different. And so we do have to start somewhere and come in with a set of assumptions. But what I would like to see folks, in a scenario like this is actually to take some time to understand what the needs are, right? So while there is a larger need of the homeless population, right, what does the need look like for that particular community? And so that does mean that we have to invest more time on the front end in the design period and the research period. And then also, we've talked about this quite a bit, the equitable piece of it. So when we look at including voices, what are those voices? How do we weigh those voices, right? I look at that second bullet, how do you weigh competing priorities and voices? I actually think that that is where we spend the most time, right? So if we're going to do a good job with what this will look like and identifying what success looks like, the second bullet to me is where it is most time intensive. And just even in the examples that Jen Rose gave with some of my more notable projects that I've worked on within the past few years, I have found even in my real experience that has been the case. We have spent on those projects the most time on the second bullet to be able to draw us to some of these other questions that we want to answer. So I agree with what Amin and Rayid have said regarding, how they might look at things as well. I just wanted to do a +1, but then also add a couple of different perspectives, again, from the more operational standpoint, but then also thinking about from a design perspective, right, how we might look at this in a more practical way. Because certainly the research questions are valid in understanding the evaluation and what changes we want to make for the next time. But I would say from the beginning, right, if we spend a little bit more time, and this is where it's difficult for many of us because we don't always have the luxury of time that we want to spend on things. I have found then that the process is a little bit easier and the results are more reflective perhaps of what we had intended than if we go in with just kind of making a broad set of assumptions and cookie cutter our way through it. So with that, Jen Rose, I'm going to give it back to you so you can take us to the next step.
All right. Well, thank you so much. I am putting in the chat. Hold on just a second. We are going to go into breakouts next, and I'm just putting in the chat these Jamboards for each breakout. So I want to thank all of the speakers for sharing your perspectives. And I think one of the key takeaways so far is there's not one right answer. And also people are going to come at this from such different perspectives based on their role and what part of the work they're working on. So there's so many ways of grappling with these questions, and we want to hear from you all. We want to hear from the rest of you in your breakout. You'll have a chance to share your thoughts on this scenario or similar scenarios and reflect on how these same kind of questions pertain to your own work. So you'll be automatically assigned, and you can go into your breakouts once you're assigned, and then a facilitator will be with you shortly.
I see a full list of participants now in my sidebar, which is really great. So thanks all for the fantastic discussion and conversation. A special thank you to our breakout facilitators, including our 3 presenters for today, who everyone's met, and also Talise Masaoe, who is a health policy research analyst at Mathematica, and in her last year, her final year as an MSW candidate here at WashU. So thanks so much to all. I'm going to launch a quick poll to help to springboard us into some note sharing and comparing for the conversation and direction things went during the breakouts. So if you'll be so kind to take a look at the poll and respond when thinking about using data to promote equitable outcomes, what part of the process is most likely to keep you up at night? We have a few different prompts and responses here: resources and funding, getting the right people at the table, having data that can help you make the case, having data that can help you execute, technology and analysis tools that focus on equity, getting buy-in, and last but certainly not least, what happens if we do nothing? So we're already at like 2/3 participation. There must be election week or election day coming up somewhere this week. People are feeling motivated to participate. So we'll give folks just another minute or two. Well, that's actually quite a bit of time. We'll give folks just a few more seconds to click a response. We'll share the results and we'll jump into conversation to be led by the amazing Jen Rose Fitzgerald. So just another couple of seconds. 90% participation, amazing. If you're thinking really hard about these different options and can't decide, feel free just to plug one in, and we'll get started with a discussion.
Just like voting. Can't decide, just plug one in.
Absolutely, absolutely. All right, 100% participation rate. Oh my goodness, that's incredible. All right, let's end this poll, share the results, and have some discussion about what we found, both looking across the rooms and then within the rooms as well. Jen Rose, take it away.
Yeah, well, I just want to say the first thing I noticed when looking at this poll is that there's a definite standout answer, which is getting the right people at the table, which is really interesting. And I do think that's a huge concern for a lot of people. So yeah, we're just interested to hear what happened in the breakouts. I was in one of the breakout rooms taking some notes, and if anyone wants to jump in about what stood out in your breakout rooms in terms of what's keeping people up at night, or what areas really popped up as the most interesting to grapple with when thinking about equitable outcomes using data.
You know what, can I jump in there, Jen Rose?
Yeah, absolutely.
I wasn't gonna jump in, but since there was enough of a silence to give me an opportunity to jump in. I mean, we had a really great conversation. It was interesting because I feel like with a lot of the input from the team, the group, we were able to get to a point where really what we found was key was that convening, right? And so how do you bring the right people to the table? How do you get the right people involved at the outset? That's important because you can then answer, once you have a key critical group of people and buy-in or whatever you want to call it that are a part of this, then having those conversations around data, one, those people at the table now can bring data with them to the table, which is colloquially called a data collaborative, right? Then you can actually identify key goals, right? And strategies for equity. What does equity mean in this particular instance, in this particular, on this particular project? And then what was key was, and I thought this was great from the group, identifying that those would be the same people that once you identify data and execute on this particular project, when you're looking for on the ground validation, that would be the same group of people that you would engage for that validation as well. So you now have this built-in system structure where you engage to create the parameters of the work, you engage to create and identify the data that's needed from these key stakeholders who you've brought to the table. Then once you execute on the work, those key stakeholders are the same people you go back to and say, here's what we did. What's the feedback? What do we need to change? How do we modify this? Have we hit or even moved towards our goal? So I think from our breakout session, it really was, if you get the right people at the table, the data conversations and all of those data questions become a bit more built in and easier to execute on.
Thank you for that. I think that resonates with our group as well. And I want to give some others a chance to chime in, though, before I talk anymore.
I'd like to chime in from group 3. So we had some similar application of what's already been said regarding this poll, but I want to add a couple of things that the group also said. And one was this goal setting piece. So, you know, if we build on what's been said in terms of the convening and getting this right from the onset, the goal setting, and then to a degree, Chapin had offered, like, even using the goals as a way to govern the process, the project, and then leading us to the outcomes that we're looking for. But I'm curious, you know, for others, part of this makes me think, you know, is there some level of formality? You know, if we are loosely convening folks at the onset, but we are looking at goal setting and then some sort of governance with the work that's being done, you know, does that require us to put a little bit more planning into place where we would actually, you know, whether it's an advisory board or, you know, dare I say steering committee, but it's, you know, interesting to think about then if we were going to try to manage to the results that we're hoping to achieve through the data, does there need to be a set of individuals that are committed from start to finish, right, to help kind of monitor and guide the process?
Yeah, I'll jump in from I think that, so that's a lot of the defining what the goal is, where we spent most of our time really, because, you know, there's a couple of people said in our breakout room, you know, when you say I want to achieve equitable outcomes, you know, what does that mean? Who knows what that means? And so getting to, well, what are those outcomes? And let's not worry about data. Let's just start with what are those outcomes? And so we identified things like, here we're basically looking at reactive, being reactive to homelessness and not preventative, because we're building shelters. So if we sort of for now say, what are those? And we're starting from a point where somebody is already unhoused. So time to getting to a shelter is a specific outcome. The shelter supporting this person's need is another in that spectrum, in the continuum. Time back in that it would take to get them to permanent housing is another outcome. And then the longer they stay there, just because we got them into permanent housing doesn't mean they're going to stay there forever. So even thinking about it as, you know, in that continuum of time to shelter, the percentage of their needs that shelter was able to support, getting to permanent housing, and then staying in that permanent housing. If those are sort of 4 outcomes that we're trying to get to, for whom, right? So we have to define specific groups. And again, we could start by thinking about that depending on where you are. Race might be, one Black people, for example, we're talking about in if it was St. Louis, what would we do? But in general, who has disproportionate higher rates of issues and that's where data can be helpful, right? Once we've identified that as a who. And then we were talking about sort of, so there's what the outcomes are for whom, and then what would equitable mean? And we sort of talked about, well, just because you have equal, let's say we can say, well, one goal might be, I want to have equal time to shelter for different groups. But that may not be equitable because let's say you are a group that has, that has an underlying medical conditions and you need to get to certain services within 2 days. And if it's longer than 2 days, it's much worse. The outcomes are much worse for you. So again, that's where some of the data can come in to identify, well, what would it mean for it to be equitable? To even have this view of, what you were saying, Allie, was about what are the different outcomes we want to achieve, and then how do we even govern? So who comes up with these? Like we just kind of came up with some of these on the fly, but who comes up with these, and who should be involved? And then once we figure these out, then they should kind of drive the rest of, the data shouldn't drive this work. These things, data can help inform these and can help achieve these, but the question is not a data question. So I think that's kind of what we talked about, is going from the goal is to ameliorate homelessness in an equitable way, which means nothing, to what are the specific outcomes we would want to achieve if we did this well.
I'd love to build off of this, I think, definitions conversation from the perspectives of some folks in group 4. We had a lot of conversations around getting buy-in, which I think directly relates to how do you define these problems, because the folks who participate really need to be on the same page ultimately about what definitions we use. But something that really struck me, in addition to some of the definitions conversation, was some comments that we heard around what types of data and methodologies do we find most compelling and most useful, and how differences in the methodologies that we choose may impact who wants to participate in these processes and what kind of buy-in we have in these decision-making circles. We talked about how obviously data is not value neutral, and how you cut data to tell different messages can really tell you a lot about an organization or a coalition's message or motivations. And so that might make it challenging then to have, a really pure use of the data to inform our initiative if we already have an idea in our head about what we want that data to do and what story we want it to tell. So I just wanted to add that from the amazing folks in Group 4, and thanks everyone for participating.
Thank you so much, Talisa. I thought it was a really interesting conversation in Group 4, and I'm sure all of the groups as well. And with an eye towards time, if anyone has any last comment that they want to make before we wrap up about something that jumped up in your breakout group, I'll give one more moment for that. Well, I really appreciate the conversation. I want to thank everybody for participating and for just thinking through these. I think what we learned and probably already knew coming in is that there are no simple answers. And I appreciated at the very outset when Amin began his comments, leading with, here's what we could have done better. Here's what we could have done. And one of the things that came up in our group, and Amin also mentioned, is engaging people or engaging organizations individually versus bringing people together who are working on the same issue, and how important that is. And I'm hearing that across all the groups. So I think that's an interesting theme that's jumping out to me. So can we go to the next slide? Thank you all for being here. Just a few things that you can do to bring this conversation back to your organization. The best way to continue to have these conversations here in St. Louis is to continue to talk to each other and really think with our organizations, like what are we hoping to promote in our work? What sort of equitable outcomes and what resources or tools would help us do that better? Because that's what our initiative is about. We're about helping try to provide some resources and tools that will help us collectively think more deeply about the process. And as a part of this, we are working to put together a collection of resources on these kinds of topics in the coming year. For now, I'm just going to drop a couple of things in the chat that could be places to start that you can also have a look at. These are just
I'm happy to copy and paste, Generous.
Okay, thank you. These are just two of many resources. The Urban Institute link, for example, resources to elevate data for equity, has just a sort of collection of resources that are about building data capacity and also thinking about equity specifically. So you can click through those and see if any of them resonate with your work. If you're working with machine learning models specifically and trying to vet them for potential biases or fairness, check out the Equitas Bias Audit Toolkit in there. And I also wanted to share, this came up in our group, for those who are interested in housing policy specifically, we've been talking about housing in this roundtable. We're planning an event in early 2022 focused on eviction prevention. We haven't set the date for that yet, but the regional response team in St. Louis is doing some great work around eviction prevention and bringing people to the table who work on the same issue from different organizations. So keep your eye out for that, and we'll share that link in the chat if you just want to check them out and learn more about their work in the process in the meantime. And then we want to hear from you. Become a member of the St. Louis Regional Data Alliance if you're not already. That link will also be in the chat. And if you have, when we want to hear from you, we hope you'll participate in the next community centered data practice roundtable, and that you will get in touch with us if you have additional questions, resources, and any other way that you would like to become involved in this initiative, to let us know what tools or resources would be helpful for you thinking more about how to use data to increase impact. So, do we have a slide for the next roundtable? I think that the date was wrong on the last slide. It's November 19th, 10 to 11:30 Central Time. And we're really excited about this one. It's all about data protection, data sharing, and who benefits. Paul Sorensen will be joining us from the Regional Data Alliance, along with some other partners, and we're very excited about the conversation. So with that,
before we wrap up, I saw a question in the chat if the slides are available after the fact. And so as soon as we can, we've been updating on the Eventbrite and our Social Policy Institute webpage with recordings from these events. So you can go back and listen and hear Amin and Rayid and Allie and Talise and the great both presentation as well as the discussions summaries. And then as well as materials and resources that will be cataloging there.
All right. Thank you all, and hope to see you at the next one.
Have a great Monday, everyone.
Thank you.
Thanks, everyone. Bye-bye.
Right.
Right.